So before I start on this topic, let's have a quick look at the history of blind schools. So if you see this picture, it's a picture in an Egyptian tomb wall where we see a blind man who's actually playing a harp. So it's the institutionalization of blind people in asylums has been there for thousands of years. Actually, it was the ancient Egyptians who were the most interested in the cure and cause of disabilities. They were also interested in a lot of rehabilitation. So normally the 18th century was the time when the blind schools were being created at that time. And the first school which was there was by Henry Dannett in Liverpool. It was called the School for the Instruction of the Indigent Blind, and it actually was a vocational institute. It was not a institute which was giving any kind of education. So if you see the history of evolution of blind schools, in the 19th century actually the Braille language came, which was a kind of a path-breaking event for the education of blind people. And in the 20th century we then what normally in India right now have are residential schools. And the 21st century is the century for integrated schools where actually the blind children now they go to the neighborhood schools and they are helped by the normal teachers and some people who are having special education. So before we do this, I'm going to tell you some few stories which are actually which have a good ending. So this is a child, 7-year-old child which we found in a blind school in Gorakhpur. And we found that during one of the screening process, we find that the child had bilateral cataract. And when we asked the child that what was the first person would you like to see? So what he told was, I would like to see my mother because I have never seen her face. And once we did the surgery and he saw his mother, we asked him, how does your mother look? So fine. So he said, actually she's more beautiful than what actually I used to imagine when I dreams. So and the story continues. This is another 14-year-old guy called Junaid, whom also we find in a blind schools. His two siblings were also blind. So once we intervened, and he had good vision in one eye, and since his children were two siblings were young, so we intended them more early and they had very good vision. Another child of a daily wage laborer having bilateral cataract residing in a blind school. After surgery, she's having 6/9 vision. She aspires to become a doctor actually. And this is not limited to poor or lower social economic status of the family. This is a child from a very middle class family in Sonipat who was residing in a blind school in Delhi. And after the surgery, the now child is reunited with the family. So we have numerous stories like this where all these children who were screened in blind schools were referred, who had actually a curable or a preventable kind of cause of blindness were referred to the tertiary care institution and were given proper treatment. So we have a lot of stories like this, smiling faces. Now all this was possible because of blind school screenings and a team and a project called as Project Prakash, which was a collaborative effort between Neuroscience Department of MIT and Pediatric Ophthalmology Department of Shroff Charity. So all these programs were conducted in the community eye health programs of Shroff Charity Eye Hospital. And this would not have been possible just by a pediatric ophthalmologist, as all my speakers have told. It's a team effort, and we had a very solid community eye health care team along with optometrists, ophthalmologists, low vision and ophthalmic technicians. So imagine if these children would not have been screened in blind schools, their life would have been a life of darkness actually. So if you look at I think all these slides have been showed by Tarannum also before, but let's re-over it. The causes of severe visual impairment in blindness children, according to World Bank region, and India lies somewhere between a low and a high socioeconomic status region. So again, retina, cornea, whole globe and lens anomalies are there, and we know that cornea and lens fall under the preventive and curable kind of blindness categories. And all the studies which were conducted for prevalence of childhood blindness, there was one conducted by Rahi et al. In a blind school, and which again showed that corneal and lens anomalies were lens cataractous blindness was a very major cause of preventable curable kind of blindness. So there was another study done by Dandona et al. And this was done in South India, in 9 schools of South India, blind schools of South India in Andhra Pradesh, and there they found that actually the corneal blindness was less and the cataract blindness because of cataract was more. The same story is in the WHO bulletin for childhood blindness also. So we find that maybe for the preventive and curable cause of childhood blindness, vitamin A deficiency, it has been already told, and cataract, it depends on different kinds of service, but from 15 to 35% in hospital-based studies and 10 to 20% in blind schools. Now, before I go into the fact that what kind of children are there in the blind schools, let's have a look at the definitions for the blindness, what we follow. So according in India, with Persons with Disabilities Act and according to National Control of Blindness, the blindness actually means that it's total absence of sight or visual acuity not exceeding 660 or visual field less than 20 degrees. For the low vision, they don't have any cutoff criteria. It's just that people who are not having good vision with standard refraction, but who are potentially capable of using vision for planning and execution of a task. The working definition of visual impairment by WHO is given by a person who has a vision with refractive correction less than 618 to light perception, or a visual field of less than degree, but is capable of using for planning or execution of a task. Now, when a child is admitted to a blind school in India, basically it is the Indian definition which is followed. So there may be some children who are actually having a potential vision for executing a task, but actually they land up in blind schools. So if you see the Indian definition, so anything which is less than 660 up till PL is actually in blindness, and in WHO 660 to 360 is severe visual impairment, and for the working definition, all these patients who are less than 618 actually come in low vision. So using the Indian definition, actually many of the children who are actually low vision categories actually land up in blind schools, whereas they have the potential of being rehabilitated in normal schools with the help of a integrated education or eye low vision team. So the importance now in all these cases to have a good functional vision. If the child has a good functional vision where he can be rehabilitated, he does not belong in blind schools. What the papers or studies are now saying that is actually only 10% of children who are in blind school actually they belong in blind schools. Actually 80 to 90% actually can be rehabilitated in the community. So what our experience tells us, the first time we started this, it was done in 9 blind schools in Delhi, which was screened during the period of 2005 and 2006, and 665 students were screened during this. And the male and female ratio, again, as has been told before, was found to be 6.5:1. So what has been found in our community-based surveys is that actually it is the families prefer to put a male child into the school, and the female child are actually not admitted because they feel maybe a male child can be benefited more than by that. So in our experience, the presenting vision of children who are actually 3/60 or little bit up till 618, we found around 55 to 60 cases like this who are in this category. So this would not have been possible without the low vision team support, where it is now mandatory that all blind school examinations screenings have to be actually supplemented by a low vision team, and total it's a community based effort. So encouraged by this, we went ahead and did 710 blind schools and community screening camps in the states of Uttar Pradesh, Rajasthan, Haryana, and 22,398 children were screened, and 192 were referred to secondary care of the hospital. Around 427 children with congenital cataract were identified, and 237 were operated, 198 dropouts, mainly because of ignorance or lack of information on part of the communities living there and the parents. So do we ever stop to think how is the life of a blind child? How does it feel to study in a blind school for blind when you actually have potential vision? So for most sighted people, blindness means actually the absence of sight. But actually most blind people have actually a small amount of vision. They may be legally blind, but they have enough vision to read some print or to navigate with some ease in the environment. Blind people may be also going to see some things and something well, and maybe not other things well. So basically they need help in that sense to help them navigate through the environment. So let's have a little talk about the blind school in India. The first special school for blind in India was set up in Amritsar in 1887, and many other blind schools have since then come in urban and rural areas. If you go to an average in a tier 2 or tier 3 town and see the blind schools there, you will find that most of the children actually having some elementary education and some elementary trades. It will be a picture like this, where I have gone to 2 or 3 blind schools myself, and I've seen either the children are playing a harmonium. There is no basically scientific effort except for teaching them Braille language. There is no other scientific effort to make them a productive member of the community. So the basically issues of concern which are there are, when we have done screening of blind schools, is that the male and the female ratio in blind schools, it's again the preference to put a male child in a school. Also, children with mild to moderate visual impairment are languishing in blind schools because of the confusion between the working definition and the standard definition. Children with multiple disabilities, who are actually patients with cerebral palsy, who may be having multiple disabilities along with blindness, actually they don't land up in the blind schools, who may be belonging to blind schools, because their other disabilities actually overshadow their disability of visual impairment. So maybe the solutions to the problem is that whenever a child is admitted to a blind school, an examination by an ophthalmologist or an optometrist has to be done, who has to have some working experience of working with children and knowledge of amblyopia, and also have an experience of using simple low visual aids. So now the services actually are more than 100 years old, but we have not even the education of blind children has not been covered even 10%. So clearly the existing model which has been working in India has been insufficient or has been incapable of handling the problem. So what could be the solution? The ideal solution could be a itinerant approach where one resource teacher can attend to the needs of more blind children in a cluster with the assistance of journal classroom teachers. So blind children actually can assimilate more than 80% of teaching and experience in a regular classroom if they are provided with the correct material in the correct form at the correct time. So the new model for 21st century, which everywhere it is propagated, is integrated education, where an itinerary school teacher is there, whose job is actually to teach plus curriculum along with the normal classroom teacher. He does family counseling and serves as a link between the teachers, students, and the parents, teachers, and the community. His another job is to do community resource mobilization by identifying the children at different stages before they go into the education model, and of course preparing and procuring instruction material, which can be done by duplication, modification, substitution, or omission. So basically, when we are looking at the problem of blind children schools for blind, there can be 3 interventions. One is the preventive and the curative approach, especially for vitamin deficiency. Secondary care intervention is identifying those children who are in blind schools and basically rehabilitating them with low visual aids. And the tertiary care intervention is to send those children who can be corrected by surgery. So basically, happiness, joy, and laughter, that is all a child world should consist of. If you see the pictures in the background, these are the paintings which are made by the children who are operated under the Project Prakash and were identified from the blind school. So I thank you for this opportunity, and I will end this presentation by saying the chief handicap of blind is not the blindness but the attitude of people seeing towards them. This is by Helen Keller. Thank you so much.
Thank you.